Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight, where we talk about Lyme disease. It's a webinar, and you ask questions, and I answer them as best as I can. Generally, I can answer most things. Sometimes you all stump me, but I'm interested to see what you have in store for me tonight. These webinars are never the same because we get into different questions each night, and you create them with your question. So ask away. The way you can do that is over on the right-hand side of the screen at the bottom, there is a chat box where you can write your question to me. The only thing I ask is that you don't hit the enter key until the whole question is complete. And this whole format works best if they're short questions, not extremely long questions. So please keep that in mind. I am never able to get through all the questions because you all ask a lot of them, which is great, but I'll get through as many as I possibly can, okay? I use each question as a means of trying to explain something about Lyme disease. So sometimes I don't get right to the answer, but I will explain things so that hopefully that you leave with some understanding of what this crazy illness is doing and what we're doing, trying to help you with it as well too. So tonight I am creating a recording just like I do every week. And tomorrow morning, somewhere around 8:30 to 9:30 in the morning, Pacific Standard Time, Seattle time, you'll get an email sent from me to you saying that recording is ready for you to view. So look at that in your email. And in that, then there'll be a sign up form for the next webinar, which is going to be in, think about that. It's going to be in 2 to 3 weeks. We're not on for next week because of being Christmas Eve. And I may not be on the next week because of being New Year's Eve. So it may be 3 weeks until we're back here again, but that's okay. So anyhow, I hope this all goes well for you tonight. And tomorrow when you do get the email, please feel free to forward it to anyone you think that might have interest in either the recording or signing up for next week's webinar. Just trying to keep spreading the word about the work that we're doing here. Okay. All right. So let's go ahead and get started here. So during the webinar, I am going to post questions. For those of you that are here, you're going to see the question post on your screen. If you're listening into the recorded version of this webinar, you will not see that question. So I will wind up reading them here during the webinar tonight. Okay. All right. So the first one's from Sarita. Says, hi, Dr. Ross. I tested positive with Galaxy urine tests for Ehrlichia and Bartonella. My LMD said I could treat the Bartonella with herbs and then I didn't have to worry about the Ehrlichia. But I've read that Ehrlichia can only be treated with antibiotics. Would you treat a positive Ehrlichia with someone without symptoms of Ehrlichia? It all depends on what was positive. So keep in mind, our immune systems do have the ability to deal with infections. Just because we see a test that's positive for a germ does not necessarily mean that germ is still in you, especially if the testing that's positive is an antibody test, okay? So the way that testing is done for Lyme, most testing that's done for Lyme is, in the Galaxy test, especially the test they would have done, is to look to see if you have antibodies. If it's an antibody test, and I think that's probably what you had done, there's two families of antibodies. There's a family called IGM antibodies and another family called IGG antibodies. The first antibodies we developed during an infection are IgM, okay? And they eventually get replaced by IgG. When your immune system makes IgG antibodies, they serve as the memory of the immune system. So even if an infection is completely gone, your immune system may still keep making those IgG antibodies. So having a test that's positive for IgG antibodies does not prove an infection is in you. We still have to consider what do the symptoms tell us, okay? So symptoms that make you think of Ehrlichia are a lot of myalgia, a lot of muscle pains, okay? So if as part of your Lyme, you've got a lot of muscle pains, then you probably ought to treat for Ehrlichia if you had an IgG test that was positive. And the treatments that work the best, I still to this day have not found a good herbal option. I agree with you. I tend to find best benefit using prescription antibiotics, and that can be anywhere from about a 2 to 4 week course of doxycycline or rifampin would be my suggested ways of treating those with prescription antibiotics, okay? So on the other hand, if you had an IgG test that came back positive from Galaxy and you have no myalgia, then it's probably okay not to focus on the Ehrlichia. All right. Thanks for the question, Sarita, and good luck to you. Hello, John Z. Let's see, or Johnny Z, that is. Hi, Dr. Ross. Can Lyme, Bartonella, or another co-infection lower blood IgM antibodies to 20 and raise blood CRP levels to 6? Any thoughts? So low IgM can be a form of immune suppression. And in theory, like Lyme and co-infections could do that. It's not a common finding, okay? CRP stands for C-reactive protein, which is a chemical marker of inflammation that is often elevated in some infections and sometimes can be elevated in autoimmune illness. But oddly enough, even with all the inflammation that we see in Lyme, it's often not elevated in Lyme, but it could be. So yeah, anyhow, thanks for that question, Johnny Z. Okay, another question here from Johnny Z. And Johnny Z, this is probably the last one I take from you so that I leave room for other people to ask questions too. But hi, Dr. Ross. I was wondering if you heard of a lab called Epiriomics. They test for almost 40,000 infections. I was just wondering your thoughts. Thank you. You know, I'm not familiar with them, but I would, if I were to look at them or have to consider them for my patients, the first thing I would do is ask that lab to provide me proof that they validated their studies. Okay, so it's one thing for these labs to come up with new ways of testing for infections. It's another thing for them to actually prove that their testing actually does find the infections in known samples of blood or in patients truly known to have the illness, okay? And most labs, unfortunately, a lot of these independent labs aren't doing it. So for instance, many of you may have had testing done through a lab called DNA Connections. I don't rely on them. And the reason I don't rely on them is they haven't done the validation studies to prove that their technique is accurate, okay? IGeneX, on the other hand, has done validation studies of each of their labs to say, yeah, this is how it works and this is how effective it is, okay? So I only rely on labs, independent labs that can show me their validation studies so that I know that what they say you have is actually true, okay? All right. Thanks, Johnny Z. Sorry, everyone. I'm noticing that was a small piece of lunch. I think I just got it there. Anyhow. All right, let's see. Hello, Paige. Let's see. Thank you, Dr. Ross, so much for everything. You're welcome. See, my son has been on rifabutin and clarithromycin, and his hair is falling out. I was told by the doctor that it would grow back, but it's very distressing to him, and no one has anything to say except that it will come back when he stops the medicine. Is there anything I can do? He's already taking selenium and zinc and collagen. Is there anything you can suggest that will help us? All right. So first of all, whenever somebody has hair loss, there's a couple metabolic and hormonal things that we should look into from a testing standpoint. So we should look and see, do they have either high or low thyroid? Either one of those can lead to hair loss. The other thing that we should do is measure iron levels. And the way that I like to do that is to actually measure the storage form of iron in the body. And that storage form of iron is a chemical called ferritin. Okay. And if somebody has low ferritin, low iron stores, that can lead to hair loss. And again, if they have high thyroid or they have low thyroid, that can sometimes, either one of those situations can be associated with hair loss as well too. Okay, so you want to do the basic blood testing for those. And then yes, I agree that sometimes it's just being on the antibiotics can lead to hair loss. But there are things you can do. I usually will put people on a vitamin B called biotin that sometimes can help with the hair loss. That's generally what my approach will be. If I don't find any issues with iron and I don't find any issues with thyroid, I usually will often try biotin as a supplement we can use to support hair. Okay? All right. Thanks for the question, Paige. Hello, London. Hi, Dr. Marty. I'm currently taking 1/4 tablet of disulfiram every 3 days and constantly feeling very toxic from all the Herxheimer. I've been doing Epsom salt baths every couple of days in addition to glutathione, but I don't feel any better after the baths. Actually, I've been feeling worse. In your opinion, is Epsom salt an effective detox method, or should I try something else? All right. So let's talk about a few things here. So number one, what happens when you take a hot bath with Epsom salt? Okay. So Epsom salt is a source of magnesium, actually. And the magnesium, if you are having Herx symptoms and you've got a lot of muscle achiness, the magnesium can get absorbed through the skin into the muscles and it can help them relax. Okay. In addition, when you take a hot bath with Epsom salts, you'll wind up heating up from the heat. And when we sweat from a hot bath, sometimes we can sweat out toxins. Now, heating yourself up, when you heat up, about 20% of the toxins that get moved by the heating process actually get sweated out. The other 80% go to the liver, and the liver will take those toxins that are fat-based and transform them into a water-soluble toxin, and then they go out into your intestines, mix in with your poop, and you poop them out, okay? So partly, if you're going to be using heating yourself up to detox, you need to make sure you're having regular bowel movements about once a day to poop those toxins out as well, too, all right? But when you're actually having herxing from using antibiotics or using disulfiram, detoxing is not the major issue. You may feel toxic. That's a feeling of feeling bad. And some people say that makes them, that feeling of bad means they feel toxic, but that doesn't necessarily mean you got the buildup of toxins in you. So what happens in a Herxheimer reaction? Let's look at that, okay? So that I can help you understand the things you can do to help with this. So when you're killing germs, either with a disulfiram or you're killing it with antibiotics, the immune system will see the dead bug parts. Okay, so whether that's the toxins from the inside of the germs or whether that's the proteins that make up the germ covering, the immune system will see these, and it will react by manufacturing a bunch of inflammation chemicals, which are called cytokines. Okay, now cytokines are also made by your immune system when they see an infection. And in the right amount, what the immune system does with cytokines is it makes them, white blood cells that see infections will make cytokines to send signals to other parts of the immune system to come in and get that toxin or come in and get that germ, okay? So the right amount of cytokines are good. But if the immune system is having a hard time, it will start making too many cytokines. And too many cytokines make you hurt, give you bad fatigue, make you feel toxic, not be toxic, but make you feel toxic, okay? And make it so you can't think, disturb how your hormonal systems work, and those excess cytokines can even disturb your sleep too. I mean, they can even lead to mental health problems, all right? So in fact, when you have Lyme disease, the main symptoms you have are actually due to too many cytokines. Too many toxins in you, like mold toxicity, can also trigger those cytokines. Yeast living in your intestines also can trigger too many cytokines. So these are all syndromes that create too many cytokines. And then when you start killing germs, the immune system sees those dug parts, and even makes more cytokines, okay? So the primary issue isn't so much the toxins from the germs, it's that the immune system is reacting by getting more inflamed and making these cytokines. Okay, so what can you do about that? Well, one is you can be on things that block cytokine production, all right? And one of those, which is an herb I like to use even with disulfiram, is to try an herb called curcumin, which is a component of turmeric, the Indian seasoning turmeric, and 500 milligrams 3 times a day. And then if that's not effective enough, you can go up to 1,000 milligrams 3 times a day. The source that I like using for that curcumin is a product made by Thorne called Mariva 500. It's a liposomal form of curcumin, which means it's microscopically wrapped in fat, which increases the absorption. Okay, all right. So you want to do 500 milligrams, 1 or 2 pills 3 times a day. Okay. In addition, you want to help the liver to remove those, to process those Lyme toxins out. And the way to do that is with the glutathione that you're currently doing. Okay, so that's a good call. I like that. But in terms of whether sweating is really going to make much of a difference, probably not. And also whether the glutathione actually is helping with the Herx, the only thing it's really doing is managing the muscle pains that happen from it, okay? So in a situation like this, I'd make sure my patient is doing curcumin and glutathione. And if they're still having bad Herxes, sometimes you got to go even a lower dose than the quarter tablet that you're doing. Sometimes you got to go 1/8 of a dose, okay? So sometimes you have to start even slower than what you currently are, okay? All right. Good luck to you, London. All right. So for those of you that are wondering what are cytokines and what steps can you take to deal with the issue? Oops, I forgot to load my other screen here. Hold on just a minute. I want to show you something, but I got to get it set up. Just a minute here. Let's try this again here. All right, so I want to show you where you can find information on my website about Herxheimer reactions and how to deal with it, and also what I recommend in with this problem when you're on disulfiram too. So I'm going to do a screen share here. All right, so this is Treat Lyme by Marty Ross MD. This is my Lyme disease information site. In terms of what to do about Herxheimer reactions, take a look at my section here in my online Lyme guide called Herxheimer and Cytokines. And take a look at this article called Control Cytokines, a guide to fix Lyme symptoms in the immune system, okay? Or you could look at my Herxheimer reaction article. They're very similar, actually, okay? All right. The other thing in terms of specific recommendations that I have for disulfiram, you can find information about disulfiram in my anti-germs section. And here's my article on disulfiram. And I just updated this in, gosh, I guess 2 months ago. It seems like it was yesterday I updated it. But anyhow, in here, I talk about whether disulfiram really works, issues about kind of side effects you might have while you're on it, when to use it, and then I talk about how much do you take of it, and then I talk about the supplements I recommend when you're on it to limit the Herxheimer reactions, and that's right here in this section, okay? All right. All right, thank you for that question. Hello, Lisa. Let's see. Hi, Dr. Ross. Thank you for your continued effort to help those with chronic illness. You're welcome. Let's see. I've been treated for Lyme and other infections since 2014. I have organically had GI symptoms diagnosed last year with hydrogen-predominant SIBO and irritable bowel syndrome. I have been treated with Rifaximin last spring. I would like to return to another round of Rifaximin, but it is too expensive and herbal treatment makes the condition worse. I have bloating, sometimes intense cramping, loose stools, and nausea. Also muscle cramping, anxiety, nervousness, and dizziness, which may or may not be related. Currently, I only take peppermint tablets. Do you have any suggestions for further gut healing, such as probiotics or other supplements? I have used Biocidin in the past, but it has been a while. I also have Inflammacor by orthomolecular products and glutalamine by Zymogen for the gut when treated with Lyme for years ago. Okay, so first of all, let me give you an idea about what to do about getting more Rifaximin that's more affordable. Okay, so there is a Rifaximin, as many of you know, is a drug that is approved for treating actually irritable bowel syndrome. Actually, it's not even approved for treating SIBO. But if we look at studies about treating SIBO, SIBO stands for small intestine bacteria overgrowth, everyone. It's a situation where our small intestines are not really supposed to have much in the way of bacteria living in them, but people can develop too many bacteria living in there, and those bacteria ferment food and other things, and it can lead to a lot of gassiness and bloating, all right? And the way to test for it is to do a breath test where you drink a type of sugar called lactulose, and then we measure how much hydrogen and methane you produce. If you have SIBO, you're going to have either high elevations of hydrogen or elevations of methane. Okay, either way. The hydrogen tends to be easier to treat than methane producing SIBO. Hydrogen will respond to Rifaximin about, I think it's 75 to 80% of the time is what the studies tell us. And of all the things we can use, is actually the Rifaximin probably is the best option. Okay. Now the insurance companies won't pay for it because no one's actually done at Food and Drug Administration, or the company that got Rifaximin approved by the Food and Drug Administration, did not apply to get it approved for treating SIBO. And so therefore the insurance companies use it as a way of denying coverage, unfortunately. Okay. So it can be real expensive stuff. I mean, it's in the thousands of dollars, as many of you may know. But there is an alternative place that you can get it. So I work with a pharmacy, a compounding pharmacy up in Vancouver, British Columbia, that will take prescriptions sent by US doctors. And they have a physician on staff that rewrites the prescription of American doctors into a Canadian prescription, and then they'll fill it. And they'll send it back across the border to you, okay? And their Rifaximin, actually, for a 1 month supply, I think it's only like 200 US. I mean, it's affordable, okay? So you might want to look at that. The pharmacy, again, in Vancouver is called Cripps Pharmacy, okay? And you can Google them and see if your physician would be willing to send a Rifaximin prescription there for you. It's affordable, okay? So I would get on something that's going to kill your SIBO again, and I would probably do the Rifaximin first. I just think you may need a longer course. You might even look at doing a month of it, not just 2 weeks, okay? That's what I would do in a situation like this with my patients, okay? But if you don't want to try the Rifaximin again, the other thing you might want to look at, and this would be using this for about 3 months, would probably be the Biocidin product. Biocidin is an herbal compound that has a variety of herbs in it that over a 2 to 3 month period of time can get the SIBO under control. It comes in 3 forms. It comes as a pump bottle, which is a product called Biocidin LSF. It's a liposomal variety, okay? Or the other way that you can do it, boy, hold on here a minute, everyone. I'm getting a lot of messages here all of a sudden, and sometimes that means that people aren't hearing me. Nope, looks like that's all worked out fine. Okay. Okay, so, all right. So the, where am I here? Oh, so Biocidin comes in 3 forms. There's a pump bottle that's called Biocidin LSF. Biocidin LSF is a liposomal variety, okay? That gets absorbed into your bloodstream and will not remain in the gut too well. So it's probably not a good way to treat your SIBO in your gut, okay? The other 2 ways that it comes are as a pill form or also as a liquid drop form. Either one of those will work to treat SIBO in your gut. All right, so you can either you can do 10 drops 3 times a day, or a couple capsules 3 times a day of the Biocidin is a way to treat SIBO. But that can take about 2 to 3 months, okay? And that would be something you might consider doing too, okay? All right, good luck to you, Lisa. Well, this is very strange, everyone. For some reason, all of my questions that you all wrote are not here. And I've got one person who's written me a question that is showing up now 16 times, which has me wondering, is anyone even still here? So first of all, can somebody respond and let me know if you all are still hearing me? I can't tell. I do see that the webinar is on, but I don't see my remaining questions here. Huh, very strange. I don't know what happened here. All right. Oh, good, everyone. Okay, I'm getting responses here. Okay. So anyhow, thank you, everyone. I appreciate that. Okay, so I'm going to take this one question, and this is from Alexander. Alexander, I don't know how this showed up multiple times, but it's here. All right, let's see here. All right. Hello, Alexander. Let's see. I took Sita, Kuda, and Hutania for Bartonella, and by the time I got to 17 drops, I abruptly got severe fatigue, no strength in arms, and heart palpitations. Do you think I could restart this protocol, or can I simply not tolerate it? I think you probably could restart it, but I would not go to 17 drops again. It may be that you hit your limit in terms of having a killing effect that was too much for your system to handle. And in fact, probably what I would do is once the severe decline that you had passes, I would consider resuming it again. And this time, I would probably work up to maybe 14 drops twice a day and just stay there. I wouldn't even try to get close to the 17 drops, okay? Because it may have, in sensitive people especially, we got to be careful to find, if we find a dose that clobbers you, don't go back there. That may be your threshold of a severe kill in your system that's causing severe Herxheimer reaction versus a kill that you can tolerate, which is going to be at the lower doses. So I'd probably shoot for maybe about 13 drops twice a day there. Okay? All right. Thanks for the question, Alexander. Good luck to you. All right. Let's see here. Hello, Cindy. Okay, my daughter had a positive IGM for Babesia decani, but treated for about 9 months with doxy and nystatin and a variety of herbs. She has been off the doxy for 9 months, but is starting to feel some symptoms return. Should we test again? Okay, so first of all, Babesia decani will often take about 8 to 10 months to treat. But the doxy and nystatin are not necessarily going to be the best ways to treat it. Nystatin is going to treat yeast. Doxy can help with Babesia, but you need to be on some kind of other antimalarials. Prescriptively, that could be something like Mepron, Malarone, atovaquone, something called Coartem. Okay, those are prescriptions you could use. Or herbally, you could have used Cryptolepis, 5 milliliters 3 times a day. So just from what you've written down here, I question if there was an adequate treatment. Doxy may help, but it's not going to adequately get rid of it, okay? At this point, I wouldn't necessarily retest, but if you've got enough symptoms coming back that look like Babesia, then I would suggest treating for Babesia again without doing retesting, okay? In terms of how to treat Babesia, let me just show you an article on that. Okay, so take a look up here in my Lyme guide. Take a look at the infection treatment plans. And there's an article here called Kills Babesia, a brief guide. Okay, and so treatments I like using, number one, the drug combinations. I call those all tier 1 up here. Okay, so I give you a variety of ways to do that. You'll see that doxycycline is part, but not the only thing, okay? Or the herbal options, which I put into tier 2, my favorite of those would be this Cryptolepis here, which is 5 milliliters 3 times a day. And you could couple that with a doxycycline, okay? All right, thank you for that question. Let's get rid of that. Hello, Eugenella. Let's see. I've been treated for Lyme and Bartonella for a year. Originally, I was treated with the antibiotic combination and herbs. Ever since then, I still have the morning headaches, burning feet, and fatigue. Since losing some hair, mold is now an issue. How do you recommend treating mold? So, treating mold, I'll show you an article that I have on it, but let me just cover a few points. So mold toxicity, so let me tell you what I mean by mold. Let's start with that first, okay? So there's a physician named Richie Shoemaker who is kind of considered to be the godfather of mold toxicity. And so I want to talk about his work, but before I do that, I want to talk about just mold in general. So when you live in a moldy environment, you can get affected 2 ways. Number one, you could have allergic reactions to the mold, okay? And that's the kind of feeling you might get when you go into a moldy environment, you get stuffy and your health declines right away, and you leave a moldy environment and you feel better. That's probably going to be more of a mold allergy kind of problem, all right? The other problem you can have is that, according to Dr. Shoemaker, who I just mentioned, around 75% of people can handle mold toxins when we breathe them in. We breathe them in from the environment around us. They go to our lungs, they get absorbed into the bloodstream, they go into the blood. Our immune system will see them. An immune system, some immune cells will tag them, and then other immune cells will come in and break down those tagged mold toxins, okay? And they don't bother us. But according to Shoemaker, 25% of us have a genetic defect where our immune systems do not tag those mold toxins. So they get into our bloodstream and they're not tagged. They don't get broken down by the immune system then. And what happens is they go to the liver. The liver is supposed to be able to transform any kind of a fat toxin like mold into a water-based toxin, but even the liver can't handle them. So the liver can't transform them into water-soluble toxin. They get moved out into the intestines. And if they were water-soluble, they would just mix in our poop and we'd poop them out. But because they're still fat-soluble, they don't mix in our poop and they get absorbed right back into the bloodstream. So you just get this endless loop of mold toxins going around that can trigger cytokines. Remember, I talked earlier tonight about those inflammation chemicals called cytokines that you make when you have Lyme that make you feel bad, but you also make them when you have mold toxin illness as well too, and they make you feel bad, okay? So first of all, you need to see, do you really have mold toxins in you? All right, so just being exposed to mold doesn't mean you have mold toxins in you. You could be one of the 75% of people that get rid of mold toxins, okay? So the way that you can look to see if you have mold toxins in you is a urine test. And there are 2 labs that do that. There's a lab called labs that I trust. There's a lab called Great Plains Lab in Kansas City, and there's another one down in Texas called Real Time Lab. I'm actually starting to think the Real Time Lab, after working with the Great Plains and the Real Time Lab now for a bit, I'm starting to think that the Real Time Lab may be a bit more reliable. Okay, it's a bit more expensive though too, but it tends to be a little bit more reliable. Anyhow, you want to see if you're peeing out a lot of extra mold toxins. If you are, that means you got a lot trapped in your bloodstream too, okay? Now, depending on what you're peeing out determines what you are going to use to bind and grab hold of those toxins in the intestines so they don't get absorbed again, okay? So for instance, if you're peeing out primarily a toxin called ochratoxin, you're going to wind up using a binder, something to bind up and pull those toxins out called activated charcoal, okay? If you tend to be having more of a toxin called gliotoxin, then you're probably going to want to use something called bentonite clay, all right? So I'm going to show you my article that gives you more details about how you use these binders and how do you test for them, but I just wanted to give you that background, okay? Now, So if you are a person that gets a lot of allergy symptoms when you're in a moldy environment, that means you have more of an allergy problem, in which case you want to treat it like allergies. Okay. All right. So let me show you the article on this. All right, so you come up here to the Lyme guide, and you want to take a look at my detoxification section, and then take a look at the article I have called Mold Toxin Illness right here, okay? And if you look through here, I talk about the genetic testing, I talk about lowering cytokines, because in mold toxin illness, that's what gives you most of your symptoms, all right? And then down here in this section, you'll see that I describe the different kind of binders you can use, and I describe what would you use, which binder for which situation, okay? All right. And then down here, I talk about how to begin using your binders, okay? All right. All right. Thanks for the question. All right, let's see here. Hello, Elise. Let's see, follow-up SIBO question. If you have methane-based plus hydrogen-based SIBO, current Lyme-Bart patient with Dr. Moz, he said I had worse test results he's seen, but I also have Ehrlichia syndrome, which he says can lead to SIBO. Does Biocidin work if it is methane also? It can, but it's more difficult. It can. To answer that question, yes, it can. Often when I'm getting more into a methane hydrogen problem, my preference is about 2 months of Rifaximin coupled with neomycin, actually, 500 milligrams twice a day. I think the studies showed that works about 70% of the time, but it does take longer, okay? It is possible that a Biocidin could work, but it takes about 3 months. I find better success, though, using Rifaximin coupled with neomycin, 500 milligrams twice a day for that situation. Okay? All right. Good luck. Thanks for everyone that let me know you're here when I asked, is anyone hearing me? That's great. I love the response. Hello, Brandy. Let's see. What is your experience with nagalase testing? Have you found it to be a good indicator for viral load in someone? Have you, let me try this again. What is your experience with nagalase testing? Have you found it to be a good indicator of viral load? If someone let's see, what is the IGG and subclass threshold levels you can use to decide if IVIG is appropriate? I'm just below normal in total and all 4 subclasses, so there is definitely repression unless it's genetic. Thank you. Okay. All right. So 2 questions. All right. So number 1, there's 2 different ways that we can look to see if somebody might have virus infections. One is not accurate at telling us whether it's really a problem, and the other one might indicate it's a problem. Okay, so first of all, some doctors will wind up testing to see if you have chronic Epstein-Barr infection or human herpes virus type 6 or parvovirus B19. These are all viruses that exist even in healthy people, but we are concerned that sometimes in Lyme, they may become more active and become part of the problem, right? So a lot of times what we can do is doctors will order antibody tests to see if you have evidence of having these viruses in you. And then if you have really high levels of those antibodies, they take it as a sign that the viruses are no longer being kept in check by the immune system, but they actually have become a chronic active infection for you, okay? All right. Now, the problem with that thinking is maybe the immune system is making a lot of antibodies because it's doing a great job keeping those germs under control. All right. There's only been one study that's ever been done looking at this theory that high IgG antibodies indicates that these infections have gotten more active. There's only been one study done looking at that. And believe it or not, that study actually did show that treating for in somebody that had chronic fatigue, the study looked at in somebody that had chronic fatigue syndrome that had high elevations of antibodies against Epstein-Barr and human herpes virus type 6, would they get better if you use 6 months of an antiviral treatment? And what the study showed is, yeah, they did. Okay, about 50% reduction in symptoms, I think. Okay, the trouble is that's only been done one time. So I still really don't know for sure if that could be replicated again. All right, because you cannot totally trust, because you can make the argument again, high antibodies means the immune system is doing great. It's keeping the germs under control, okay? So because of that, I've looked for other ways to look to see what is a true estimate of your viral load. In other words, have the viruses gotten active? Did the immune system lose the battle? And what I like to use for that is to use a test called a nagalase. Nagalase is an enzyme that is made in the covering of your viruses. And what the viruses make it for is they use it to deactivate a chemical that is used to turn on a type of white blood cell called a macrophage, okay? So nagalase breaks a sugar group off of an enzyme called GCMAF, which is a macrophage activating factor, breaks a sugar group off of that macrophage activating factor, making it so it doesn't turn on the macrophages and you kind of lose that line of defense to help fight the viruses, all right? So in theory, nagalase levels, if you have higher amounts, it means you got more viruses in you, okay? So that's what I tend to use to help me decide if I'm going to treat for viruses. And you could use it as an indirect way of measuring what's your viral load. Are they still under control? Okay, yeah, so I think you could wind up doing that. In terms of IVIG, I got to tell you, I'm not the best expert on that. I will usually take my patients that have low subclasses and refer them to an immunologist to take a look at. Part of the reason I'll do that is insurance companies really don't pay much, will often not pay for it. And out here, I have better success if it's an immunologist ordering IVIG than me, okay? But what I have learned from the immunologist here is that you have to have some pretty large decreases in your antibody levels and your subclasses before they recommend doing the IVIG and before insurance will pay for it. Okay, so those would be my comments too. Not small decreases, but huge increases is what they're decreases in levels is what they're looking for. Okay, all right. Thanks for your question, Brandy. Hello, Crystal. Let's say hello, Dr. Ross. How was your day? It was good. Thank you. A little tired here at the end of the day, but it was good. See, I'm having trouble tolerating the full dose of my Bartonella antibiotics, 300 milligrams 2 times a day of Rifaximin and 160 milligrams 2 times a day of Bactrim with methylene blue and oil of oregano, Saccharomyces boulardii, HMF probiotics. The antibiotics are causing gastrointestinal issues when taken as directed. However, I seem to be able to tolerate the medicine if I spread it out during the day, i.e. take 150 milligrams of Rifaximin 4 times a day instead of 300 milligrams twice a day. Will antibiotics such as Rifaximin and Bactrim still be effective against Bartonella if the prescribed dose is divided into smaller doses and taken throughout the day? Thanks for all the ways you have helped and healed our community this year. Happy holidays and all the best in 2021, Crystal. Thank you, Crystal. I appreciate your good wishes there, your well wishes there. So, it's interesting. The Rifaximin is an antibiotic that is as effective either if you take it all at once or twice a day. And because of that, I presume it would still work well in somebody if you took it that total daily dose and divided it in 4, okay? I don't know about Bactrim, whether it's going to be as effective if you take it multiple times a day or not. I just don't know. But if I had a person in this situation, I might try to do it that way and see what happens. I would just observe and say, this isn't a common way we do it. Let's see if you get better by giving it a try. Okay. Now, keep in mind with Bartonella that when you're using a method to treat Bartonella that is working, usually after you've been on it for a month or two, you should start seeing improvement in those Bartonella symptoms. Okay. So you could try your Bactrim, smaller dose 4 times a day, and try your rifampin at a smaller dose 4 times a day, and then see what happens at 2 months, and see if you're getting any better. Okay. That would be one way to look at it. Okay. All right. Thanks for the question, Crystal. Good luck to you. All right, let's see here. Hello, Ms. Eve. Let's see. Are you familiar with dark field microscopic live blood analysis and Sanum products? Someone recommended I consider based on my hypersensitive adverse reactions to many products that have been a variety of practitioners for treating mold Lyme since 2012. About 75% better. I've experienced negative reactions, just to name a few, from Biocidin, neem, activated charcoal, bentonite clay, highly allergic to antibiotics, adverse reactions for both prescriptions and a variety of natural medicines. All right, so let me start with question 1. Okay, so first of all, I don't know the Sanum products. I haven't used them before, so I can't speak to them. In terms of dark field microscopic live blood analysis, I don't trust it. I know people think they're seeing something under there, but who knows what they're seeing, because it's a variety of germs that all look the same. Okay. So I don't, it's not recognized in most pathology systems as viable, true ways of looking at things in terms of diagnosing. Okay. I know there's people out there that do it, but I would say it's not validated. That's my thoughts on that. Okay. All right. Number 2, let's see your view about sauna therapy. Any recommendation for a type of sauna? Any natural remedies for resolving fungus and candida? That's number 3. Okay. Let's go to number 2. So I like far infrared saunas, and I don't have a specific brand recommendation, but sauna that uses far infrared wavelengths is what I like. And what that does is it heats you up. It heats you deeply. Okay. So if we look at standard ways of heating a person, either sitting in a hot tub of water or being in a regular sauna, what happens is you heat up from the surface down into the tissues. Okay. So the heat hits the surface of your skin, and slowly starts working deeply down into the tissues. Okay. That's how regular heating works. All right. Now, far infrared uses wavelengths that penetrate deep into the tissue. In fact, they penetrate about 2 to 3 centimeters down. So you get equal heating. You're as hot here on the surface as you would be about 2 to 3 centimeters deep. Okay. So so you know how when you stand in a sunshine or in front of a window that has a lot of sun showing into it, and you get hot really quickly, that's infrared rays that are doing that. Okay. So what happens when you heat up and you get that deep heating, that causes your blood vessels to dilate, which brings any medicines you might be on deeper into your tissues. Okay, number 1. Number 2, you can sweat. And when you start sweating, that helps move toxins out of you. Although when you heat up, 20% of the toxins come out in the sweat. The other 80% get moved out into the intestines, through the liver, and you eventually have to poop those out. So again, as I mentioned earlier tonight, make sure you're having regular bowel movements if you're doing saunas to detox. Okay. Now, when I advise somebody to do far infrared sauna to get better blood flow and possibly to help with detox, I like them to start at 15 minutes 3 times a week. And once they're stable on that and they're not worsening from doing that, then they can go up to 30 minutes 3 times a week. Okay. And you try to get that temperature up to the max range that you can tolerate, about 120, 140 or so in the sauna is a good temperature to do that, okay? So that's how and why to do it. I don't have a brand recommendation for you though, okay? And then let's see, any natural remedies for resolving fungus candida that you, thank you. Okay, so, you know, my, the product that I have that's available right now does work fairly well. It's a use a combination, it's a product called Phytostan that works about 80% of the time over a 2-month period of time. That's basically what I see in my clinical experience, okay? And that's a product called Phytostan. Phytostan has in it a number of herbs. Those herbs are caprylic acid, powder kohl, rosemary oil, I believe thyme oil is in it, and indolicic acid as well too, okay? So you can find a combination product that has some of those in it. Sometimes these combination products in addition will have garlic. Some of them might have grapefruit seed extract. But that whole list of herbs that I just mentioned are herbal remedies that often are put together in a combination pill that can help get rid of yeast. My favorite is actually a product made by a company called Karuna called Capri Plus, but they are just out of supply. And I think it has something to do with COVID-19, but that's a combination of caprylic acid, rosemary oil, and garlic. That I found to be my more strongest way of doing it, but that product is just not available at this point, okay? All right. Thanks for that question, Missy. Hello, B. Let's see, are there new studies or recommendations for Morgellons? Not that I'm aware of. I mean, there are some studies. I know that, I'm blanking on her name. I believe Judy Miskovitz has done some studies showing that when people have Morgellons, if you do biopsies of the tissue, you're going to find spirochetes, basically, or Borrelia, Lyme, okay? My clinical experience with people that have Morgellons. So first of all, everyone, Morgellons is a skin condition that has these rashes and changes to the skin that are there. And also sometimes these rashes or skin changes, non-healing skin areas will have filaments that come out of them, black filaments that come out of them, okay? The filaments have been studied. They're not an infectious agent. Some people think that they're made up of connective tissue like keratin, for instance, okay? What we have tended to see in Morgellons is about 90% of people with Morgellons will test positive for Lyme. And about maybe 10% will have other immune suppressing disorders like HIV, for instance. Okay, those tend to be the two conditions. If you see Morgellons, it's probably going to be Lyme or possibly HIV under it too. The way to treat it is treat the Lyme. There isn't anything more specific to what to put onto the lesions that necessarily works. The main thing is to actually treat the Lyme with antibiotics and all the other things that we do. Herbal antibiotics or prescription antibiotics and all the other things we do to manage Lyme disease, okay? All right. Thanks for our question. Hello, Angela. See, I've stopped treatment when I've been symptom-free for 2 to 3 months, and each time I relapse. So this doesn't help to know when to stop treatment. What tests are the most accurate to show you actually stop treatment? I have heard about red phage tests being very accurate for this, and tlabdx.com for Bartonella. How do you know you are not going to relapse? Do you ever become completely negative? All right, so good question. So in general, I have found in my practice, for most people, not everyone, that 2 months of being symptom-free usually means you're done and you won't relapse, okay? In general. Now, that doesn't mean for everyone, okay? And I think that's what you're trying to tell me here. Unfortunately, we don't, so the testing that we generally have at this point for Lyme and for Bartonella are tests that look at your immune system. All right, so those, and I'll come to the red phage test, the red labs phage test here in a minute. But the testing that we do through like an Armin Labs looks to see, are your T cells reacting against Lyme or Bartonella? So it's an immune system test, okay? And then IGeneX and its Immunoblots and Western blots and IFAs, those are looking to see, do you make antibodies, which is immune testing, all right? Now, some of my colleagues these days are starting to do repeat Elispots and repeat Immunoblots and Western blots to try to get some gauge that they are done with treatment. But keep in mind, all that it's measuring is immune reactivity. That doesn't measure germ load in you, all right? So if you get less immune reactive, it could be that your germs are more active and that is suppressing the immune system. Now, some of my colleagues look at these tests and they say, oh, you're not making as many antibodies, or your bands aren't as intense, or your Elispot numbers are down. And they take that as some clue that if the immune system isn't as reactive, that the germs must be getting under control. My response to that is, really? There's no proof that correlates any of that to germ load. There's no studies that have been done about that, okay? In addition, if the Lyme has gotten more active, it's going to suppress the immune system, and you can't have the reaction, all right? So there is really not a decent way of doing antibody or immune testing. So Elispot testing or Western blot or IFA testing is not going to be reliable at telling you where you are. Okay? Because of that, there are some people that are exploring, well, how do you test the germ load? Okay. All right, so then you've got Red Labs, which has their new phage test. And what this is, phages are basically viruses that will live in a person whenever they have a bacteria. So different bacteria have different phages that will be there. So if you test somebody and they have a lot of phages, that could indicate, for that germ, that could indicate that you have active germ in you still, okay? In theory, that sounds great. No one's done validation studies to know if that's true, though. We don't know. So I know that Red Labs is marketing itself as a way of telling if you truly have the germ in you, or you truly have a certain load of the germ in you. But the trouble is they haven't done the studies to say, does it truly correlate with the actual virus load, or bacteria load that is in you? Those studies don't exist. So at this point, the only gauge we have is to look at symptoms, and they're not always reliable, okay? Unfortunately. So, Angela, what I would say to you is there isn't a decent test to know that you're done, unfortunately. I wish it was different than that, I really do, but there isn't. All right. Thanks for that question. Hello, B. Let's see. Are severe spasms related to using rifampin? So rifampin, as many of you know, rifampin is an antibiotic that we use primarily to treat Bartonella, though you can use it as part of your Lyme germ treatment too. It's a medicine that was originally approved for treating tuberculosis, actually. And that's probably the main reason it's used by most doctors in the country right now. But rifampin has a side effect list that is 20 miles long. I mean, this thing is huge, all right? The thing that's interesting about rifampin is any of the potential side effects, I find in my practice only occur about 5% of the time. So although it looks like a scary drug compared to many other drugs, in reality, most people don't have problems. In terms of severe spasms, it's not a common symptom I have seen with rifampin. And I'm not even sure if it's listed as a side effect, okay? But what I would tell you is there's a rule of medicine that I have, the Marty Ross rule of side effects, okay? And here it is. And that is anything can happen to anyone with anything, all right? Which means it doesn't matter if somebody else hasn't described an effect on a medicine. If it happens to you, and we can figure out that it really was coming from the medicine, it's a side effect that happens in you when you use that medicine, okay? So the way to see if rifampin is giving your side effects of spasms, stop it. talk to your doctor about it first. Don't don't go to them and say, Marty Ross said you're supposed to stop my rifampin. Okay, but talk to them, have a discussion and say, I want to try to understand, is rifampin giving me spasms? And rifampin, the way it's cleared out of your system within about 24 hours, I believe. So if you stopped it and watched over a 3 to 4 day period of time, saw what happened to your spasms. If they went away, then start it again. And if they come back, guess what? It's probably a rifampin side effect in you. Okay, all right. So again, that's the Marty Ross rule of thumb. Anything can happen to anyone and anything. Even though there are common side effects, we all can get side effects that aren't listed in any drug directory. Okay, all right. Thanks for that question. Let's see. Hello, Diana. Let's see. I've been diagnosed by a blood test in Ontario, Canada. I was treated with antibiotics for 3 weeks, and now I'm being told there is nothing my doctor can do for me. I still have pain in my joints and feeling kind of crappy. Any suggestions? So Diana, so you've entered the politics of Lyme, unfortunately. So there is an opinion among the infectious disease doctors, which unfortunately is the predominant viewpoint, and it is followed by even primary care doctors. And that is that 2 to 4 weeks of antibiotics will get rid of Lyme if it's in you. And they believe falsely that if you're still sick after those antibiotics, that it probably is an immune condition or an autoimmune condition that was triggered by the Lyme, but they don't believe the germ is still in you anymore. And so therefore they say, don't use any more antibiotics. And unfortunately, that is the prevailing viewpoint. It's wrong, but it's the prevailing viewpoint, okay? Much like we used to think that the world was flat, and everyone believed that and held on to it for a long time. And eventually it was shown that it really was round and a globe, but everyone held tight to that viewpoint that it's flat. So right now, everyone holds tight to that viewpoint that doxycycline is always cured with 3 to 4 weeks of doxycycline. But we have lots of data that shows otherwise, okay? So we know that there's data that shows that when people do the standard 3 to 4 weeks of doxycycline, that approximately 15 to 20% of people will go on and have chronic health problems afterwards. Okay, we know that. There's data that shows that, all right? There's also data that shows that there's been studies done that do prove that the germ can keep living. Although we don't have those studies we can do in you, there's laboratory methods we can use to look and see, do the germs continue? And there's been ample studies that show that. So I'm of the viewpoint when somebody doesn't get better with their 4 weeks of antibiotics, that you keep treating. And that's what I would suggest, is that and to anyone that has ongoing symptoms of Lyme after they've been diagnosed and it's been shown in a lab, or we have clinical evidence they have it, I would keep treating for the Lyme longer, okay? The other thing that I would look at doing is to make sure that you don't have a co-infection, meaning another germ that got transmitted by that tick that should also be treated. And those common other infections that can be transmitted, one is called Bartonella, one is called Babesia. And if you happen to have those sometimes will make it harder to treat the underlying Lyme infection, okay? All right. Now, so you need to probably talk to an experienced doctor who knows Lyme disease that can help figure out, is there Babesia there? Is there Bartonella there? And if you do, then you need a different treatment than doxycycline. If not, you probably could keep using doxycycline for another month or maybe even 2 months, but you need to have somebody that can help you look at that. And if you can't get doxycycline up there, no one will prescribe for you, then you need to figure out, there are herbal options you can use to treat the Lyme germ, but before necessarily saying that that's what you should do, I think you need to talk to somebody that can help you look at, are there other germs there that blocked your treatment, okay? All right. So I don't know if you have anyone you can visit with. I doubt it. I know Canada is a tough place right now, but let me show you something you can take a look at here. I'm going to do a quick screen share. All right, so this is back at my Lyme information site. Click on my clinic link up here. All right, this is my practice website. And you could take a look. I'd be glad to help you online, or anyone that has questions that they're not getting answers from their doctors. Click on my appointments. And there's two types of visits. I'm doing all telemedicine visits right now. I visit with people in Canada. I visit with people anywhere. And you can read about the two options. Option one is a type of visit where I can prescribe. Option two is a visit where I don't prescribe. There are different price options. There's different forms you have to fill out. But see if one of these options is something that would work for you. I'd be glad to take a look and help you figure out what's still there that needs to be treated, okay? And also just keep in mind, as I said, the main point I'm trying to tell you is I don't think 3 weeks was enough in you. There's some germ there, probably Lyme, and maybe that you've got some co-infections going on too that blocked your treatment, okay? All right. Good luck to you, Diana. Hello, Lynn. Let's see, Dr. Ross. Are there any supplements or herbs that should be stopped before getting the COVID vaccine? For example, would cytokine inhibitors interfere with the vaccine's effectiveness? Also, you mentioned that people with autoimmune disease might want to be cautious with the Pfizer vaccine for COVID. Does that include a diagnosis of psoriasis or collagenous? Not sure what you mean by the collagenous one. So let me kind of clarify that. So in terms of the COVID vaccine, and I talked about this last week, and as many of you know, I have an article up about it. And so anyhow, so in the Pfizer studies, as in the Moderna, although I haven't looked at the Moderna yet, I have to look at the Moderna studies, but in the Pfizer studies, they did not break out whether there were people that with Lyme that were tested in their in their studies, their safety studies, and their effectiveness studies. Okay, so we don't know. All right, and so because of that, what I decided to do is to look at the literature to say, okay, is there any literature about what happens with people with chronic health conditions that can help guide me about what should we consider with people with chronic health conditions? Are people with chronic health conditions like Lyme susceptible in any way to an adverse outcome that people without Lyme are not subject to? Okay, all right. Now, if we look at the safety studies for the COVID vaccine, the Pfizer studies, first of all, it's 95% effective, and the relative risk of a side effect was extremely small. I think it's like 1% or less. It's very, very small, okay? All right, so what the literature tells us about all vaccines that have ever been given, I'll just say it that way, is first of all, people that have had anaphylactic reactions to severe allergic anaphylactic reactions to other medications or immunizations may be at a slight increased risk of that happening with the COVID vaccine. Now, because we're still learning about this vaccine, I suggested last time that if you are somebody with Lyme that has had anaphylactic reaction, that for right now, until we get more information about the relative risk of anaphylactic reaction in Lyme, you probably hold off on getting it. Okay. All right. Number two, if we look at data about people with autoimmune illnesses, all right, so people with Lyme, some people with Lyme have an autoimmune component to their illness. And by autoimmune, it means your immune system is making antibodies or white blood cells that are attacking your tissues. And we can see that with blood evidence often by people that have elevated rheumatoid factors or elevated anti-nuclear antibodies, all right? Or they have been diagnosed with another autoimmune illness like a psoriasis, which doesn't necessarily have blood testing, but there is clinical evidence they have it, or something like Sjogren's disease, any of those what we call autoimmune illnesses for which you have been diagnosed in addition to your Lyme, that means you have an autoimmune condition. Okay, now we can argue about whether Lyme triggered the psoriasis or Lyme triggered the Sjogren's or Lyme triggered your lupus. But if you have been diagnosed either by somebody that with expertise in diagnosing those autoimmune illnesses, or you have laboratory evidence of an elevated anti-nuclear antibody or elevated rheumatoid factor, what the data tells us for all vaccines is that people that have autoimmune illnesses have a very small increased risk of getting another autoimmune illness when they've had a vaccine. Okay, so that's called relative risk. So if we look at some of the data on that, the relative risk for, I think like the hepatitis B vaccine, of people getting another autoimmune illness or getting an autoimmune illness, I think the relative risk is like 1.1 to 1.2. Okay, let me explain what that means. So 1.1 means you have a 10% increased risk over the general public of getting rheumatoid arthritis, for instance, okay? Or a 1.2 risk means you have a 20% increased chance over the general public of getting rheumatoid factor, all right? Now, keep in mind, getting rheumatoid arthritis, I don't know what, I think it maybe, I would bet it's less than 5% of the US population has it, okay? So a relative risk of some of an illness like rheumatoid arthritis that might occur in 5% of people. When we talk about relative risk, it means that you have at least a 5% risk for just living of getting rheumatoid arthritis. And if you do something that has a 1.1 relative risk, that means you've increased it by a 10% over the general public. So 10% of 5 is 0.5. So your relative risk goes from 5 to 5.5 I think I did that correct, over the general public, okay? So it's still a low risk, all right? So you have to consider, even though you get a relative risk increase of 1.1 to 1.2 or so of having autoimmune illness from getting a vaccine, if you already are prone to autoimmune illnesses, it still is a small increased chance, but you need to consider it when you're making a decision about whether you might want to get the COVID vaccine or not, okay? All right. So I just wanted to make that point here. It's not an absolute contraindication, but it is something to consider, okay? All right. Now let me see what your rest of your question was. Oh, in terms of cytokine inhibitors interfering with the vaccine effectiveness, I am doubtful it would, because it's not going to, I doubt it will. I don't know for sure. Okay. Again, we just don't have the studies that tell us that. Yeah, I think I answered your question. Okay. All right. Good luck to you, Lynn. So for those of you that missed it last week, I actually recommend that I think that once it becomes publicly available, that most people with Lyme should get the COVID vaccine, because the risk of getting COVID and having a bad complication is greater than the risk of harm that could happen by getting the vaccine. Now, I want to let you know, I've been skewered by some people for that opinion. So just like we're polarized in this country between Democrats and Republicans, you should see the polarization within the community about vaccines. It's the same thing. And I knew when I published an article last week about that I was probably going to be subject to getting hit. And I stand by it still. There is greater risk of dying from COVID than you're going to have from risk of getting a vaccine if you have Lyme, okay? There's going to be greater risk of permanent fatigue or brain dysfunction from getting COVID than risk, I think, of getting harm by the COVID vaccine. And so because of those great risks, I still stand by my opinion that, yes, I think it's something valid, even though this vaccine has not been fully studied in people with Lyme. I still think that the risk of getting injured by getting COVID is much greater, okay? So I stand by that. And I know there's some people that are just outraged that I have that opinion, but that's my opinion. So anyhow, there you go. All right, let's see here. Let's see here. Hello, Lorraine. Let's see. Dr. Ross, please show us your Basenji's Thor and Halo, not Lola, Halo tonight. Thank you from a dog lover. Wow. Wow. They've been called out. They will come. Let me grab them here. Let's see here. Okay, so first of all, right back there, that's Thor. Yeah, that's his spot to sleep in these days. Hey, Thor. Okay, that's Thor. Okay, all right. Halo, come here. Halo, come here. Come on, come on, come on. Come on. You've been requested. I'm trying to get her awake here. Just a minute. Halo, come on. Come on. All right. So this is Halo. And she's my older dog. She's 13 years old. She is half sibling to Mr. Thor. And Thor's a little bit of a scaredy cat, but these are my two Basenjis. So they come to work with me. They got a job to help people around here. And when I'm seeing people in person, I know a lot of my patients enjoy having them. I give them a choice. I don't throw my dogs at people, but if somebody wants to see me and have them out, they'll be out. Otherwise, I keep them in a crate under my desk, basically. So yeah, that's them. Thank you for asking about them. All right, let's see here. Let's see here. Johnny Z, let's see. Hi, Dr. Ross. Happy holidays and Happy New Year. Thanks to you. You're welcome. The same to you, Johnny Z. Hello, Sharon. Let's see. What do you think about Green Dragon protocols for Lyme? Some of their products would be like cat's claw and some of those things. I support that. In terms of the rest of their protocol, I don't know. I haven't looked at it specifically enough to give you some good detail on that. Okay. All right, let's see here. Hello, Christina. Let's see. Hi, Dr. Ross. Had an MRI years ago due to chronic hearing loss in my left ear. Shockingly, they found lesions on my brain, probably from Lyme disease. I did have Lyme in 2003. Do you know if the lesions can eventually grow or do they hopefully stay the same? Thank you for all that you do for us and for taking time to have these conversations for us too. Thanks for all your great website. Have a wonderful holiday in spite of COVID, Christina. Thank you, Christina. And thank you for all your well wishes there. I wish the same back to you and actually everyone attending here tonight. Okay, so in terms of brain lesions, so it's possible that when you have Lyme and you have brain lesions that are from Lyme and you get treated, that they're still going to remain. Okay, sometimes actually as you treat, they go away. But sometimes they still remain. Now the issue is if your Lyme is gone and the only thing you have left is brain lesions, they're probably not going to expand anymore. Okay, but if your Lyme is still in you and still active, they could spread. And I don't know enough about your situation about helping you determine whether I think Lyme is all the way out of you or not, but that would be my response to that. Okay, all right. Thanks for that question. Good luck to you. Hello, Christine. Let's see. Thank you for all your brilliant information throughout the year. I've learned so much. Have a wonderful, beautiful holiday. See you next year. Thank you. I like we're getting towards the end of the webinar here tonight, and we're getting all these thanks and Thanksgiving, and that's what this time of year is about ultimately. So I wish you the same as well too. Thank you. All right, let's see. Oh, I think we already answered this one earlier. Oh, I think you've added more to it. Let me see here. Hi, Cindy. See, my daughter had positive IgM for Babesia tacani a year ago, but had a negative IVIG for Babesia decani. Does that make sense? In addition to the doxy and nystatin, she did take atovaquone for about 1 month a year ago. Her primary symptom now is extreme fatigue, light sensitivity, brain fog memory issues, and possible mood issues. So again, if it was only a month, that was probably not adequate treatment. But her symptoms, if you look at the extreme fatigue, that can sometimes be part of Lyme, that can sometimes be part of Babesia. The light sensitivity, brain fog memory issues is going to fit more with Lyme or possibly Bartonella. Mood issues is going to fit more with Lyme or possibly Bartonella. So I guess what I would, to give you the best advice here, I'd almost need to ask you a bunch of questions, which this format doesn't allow for it, so that I can figure out more from a clinical standpoint what's still going on, okay? And I would ask a lot of things more about Babesia symptoms and more about Bartonella symptoms and more about Lyme. But what you've put here leans more towards Lyme and Bartonella possibilities as opposed to Babesia, but I have an incomplete picture. I'm not getting to ask you all the questions I normally would ask, okay? All right. Thanks for your question, Cindy. So Babesia, as I said, the Babesia decani typically takes Babesia decani, that kind of Babesia is going to typically take about, can take up to 10 months to get over. Okay, so I'm doubtful that 1 month of atovaquone would have been enough for that. Okay, all right. Let's see, Ms. Eve, looking forward to seeing you next year in the medical profession. You, sir, are a rare gem. Truly, you are. Blessings and love to you and to all. Thank you. Thanks, Ms. Eve. And believe it or not, everyone, I think that this is going to be it. This is the last question, unless we only got about 5 more minutes, but this is the last active question that I have here. Let's see. Hi, Sandra. What is the best treatment for longstanding neuroborreliosis, which is causing neuropathy, head pressure, balance, and spastic gait problems? Is this a situation that would merit IV ceftriaxone? I've had this for 1.5 years. Thank you. Sandra, I'm sorry to have to say this, but I would need a lot more information to guide you as to whether this is an IV antibiotic situation or whether this is something that oral antibiotics could work for, because they could, okay? Part of the questioning that I would need to ask you is what's going on with all of your other symptoms so I can figure out which germs are here. So for instance, this could all be Bartonella, of which case usually oral antibiotics can work fine for even neurobartonella, okay? I would need to know more about other things you've tried to support your nervous system, whether they worked or didn't work, et cetera. So I'm not going to be able to answer this question right now. If you would like some insight from me, take a look at my, click on the clinic link at the top of my Lyme information site and go to my appointments page at my clinic and look at one of those options where I could visit with you online to help give you a better discussion about what's going to be the best option for you. Okay? All right. Thanks for that question. Good luck to you. Cindy and Margaret, thank you for your comments. I appreciate them too. So anyhow, everyone, that's it for me for this year. And Charles has just asked a good question. I'll say it says, if you had a brief bout with COVID, is the vaccine still recommended? It's a very interesting topic, is what to do with people that had COVID of any duration. When you have COVID, does that give you lifetime immunity or long-term immunity? And the answer is the studies haven't been done. We don't know. And so if you look at immunization experts at this point, because we don't know whether getting COVID gives you as good of immunity as getting the vaccine, we don't know. We honestly don't know. In theory, if you got the germ, you probably should have immunity to it, all right? But we don't know how long that lasts. So at this point, the experts, immunization experts, are still recommending COVID vaccine for people that have had COVID of any kind. Okay. And I think that makes some sense to me. Okay. All right. All right, everyone. That's it. So happy New Year. Happy holidays, whatever holiday you celebrate at this time of year. And I look forward to working with you all next year in 2021. I suspect we're probably going to begin the webinars again during the second week in January. I'll probably take the first week off. I think, wait a minute. I'm sorry. It'll be the first week in January. I will not be with you on New Year's Eve, though, I guess is what I'm trying to say. So there we go. All right, everyone. So take a look at your emails tomorrow morning, somewhere around 8:30, 9:30 in the morning. I intend to get the edited version of the recording out with an email to that. And then that will also have a sign up for the next series of webinars. And please share the information that we're doing here with other people. If you think they may get benefit, I'd appreciate that. Okay. Good night. Happy holidays, everyone.